All right, great to be back. Thank you everybody for joining. First, I want to acknowledge, the passing of a massive figure in the world of bioethics. Tom Beecham. I want to extend my dearest condolences to Ruth and their friends and family. For most people who go through medical school, the Beecham and Childress four principles of biomedical ethics are their only exposure to bioethics and the only bits they bother learning about because it's what they're tested on for their board exams. So needless to say, he's had an immeasurable impact in the world of bioethics and medicine. Certainly will be sorely missed. But as for today's talk, thanks again for joining. I'm going to be diving into a topic I believe warrants a lot more focus than it's currently, the current levels of attention it's getting. And it really lies at the intersection of a variety of different disciplines, which I think is really poignant for, Berman Institute. We're housed in the Bloomberg School of Public Health, unlike many other bioethics institutes, which are in schools of medicine. And public health really just sits in a situated way just at the intersection of all these different disciplines. So generally, we'll be speaking about wastewater surveillance and some ethics around that, and more specifically in application to military context. And as any good federal government employee, here's my disclaimer saying that anything I say does not represent the US government or military. And in fact, it has gone through clearance and it is unclassified for public release. So there you go. This is what we're going to be talking about today. So quick overview of what wastewater surveillance is, a little bit about that history and science behind it, since I'm not sure if everybody is aware that it exists and that we're currently utilizing it at a national level. Some specific military considerations in terms of ethical pieces that kind of make that military context unique. Ultimately wrapping that all together into specific ethical considerations for wastewater surveillance in the military. And then this last little piece, which I tacked on, which has been kind of gnawing at me more and more, particularly over the last year, in terms of bioethics communications and action, and really translating what it is that we talk about and we write about into actually doing something about it. So what is wastewater surveillance and why should I care? Thinking about what topic should I talk about for the seminar today, knowing that it's going to be in Finestone during lunch, and what better way can I activate people's gastrocolic reflex than talking about wastewater? So quick overview here. So, we've used stool tests in a variety of different ways clinically for many years, looking at, colorectal cancers, enteric infections, malabsorption syndromes, inflammatory bowel diseases. But there's really many more uses for stool in terms of detection of disease through public health and wastewater. And in recent years, there's really been an emphasis on infectious diseases. So how does it work? So you're eating your lunch here at Finestone. Maybe you've had a cup of coffee, and that old familiar rumble starts to happen in your gut. You got to go to the bathroom. You go number one or two or both, and then you wash your hands. All of it gets flushed down into the sewage system. Where does it go from there, right? It ends up collecting with larger pipes feeding into a larger wastewater system, which ends up going to wastewater treatment facilities where it's treated and then released back into the environment or recirculated for use in our drinking water or other types of uses. So one thing that's important to note is for the infectious diseases you're able to detect in wastewater, it's not regulated to just gastrointestinal infections. We find that, for example, in SARS-CoV-2, that virus, when it infects you, it's not just infecting your lungs or your nasopharyngeal tract, it's also infecting the epithelial cells lining your gastrointestinal tract. And what your GI tract does is it sheds those cells kind of over time through a natural process. And so we're able to detect genetic evidence of virus that infects those epithelial cells of your GI tract in wastewater. And a lot of times we can detect it for even a week after you're done being detectable through a nasopharyngeal swab for a respiratory infection like SARS-CoV-2, for example. And that people will shed genetic evidence of infections regardless of their symptoms. So you could be asymptomatic, just carrying an infection with a respiratory pathogen and shedding evidence of it in the stool, which you otherwise would not be getting popping positive for on a typical clinical test through a nasopharyngeal swab. And so the other piece that's unique to this is particularly for viral pathogens, we're able to detect kind of the amount and burden of virus in the wastewater as it tracks with the levels of infection in human populations over time. So the more human infections we see more viral burden in the wastewater. We're able to do this through quantitative PCR. We're able to really get down into some genomic epidemiology and lineages through next generation sequencing and bioinformatics. So really, there's a tremendous amount of public health importance and potential here. And I think it's also important to track just a little bit of the history. So really, poliovirus was where wastewater surveillance first started, and you can reach all the way back to 1939 when it was first kind of starting to be teased around as an idea, and really started being used in earnest with the WHO in 2003. And I think the difference there was any detection of poliovirus in the wastewater was a red flag and would alert public health officials to implement control strategies, ring vaccination efforts, and really target that. It wasn't looking necessarily at levels as much as it was yes or no, is it there? We need to act on this. In the 1990s, expanded out for various other microbial pathogens, and this really expanded our ability to detect other pathogens with via PCR in the wastewater. And then came 2020, where SARS-CoV-2 came, and it came at a time just when a critical mass of academics were getting invested into wastewater surveillance and molecular analysis of pathogens via quantitative PCR sequencing methods. Sequencing methods have become more cost-effective at this time as well. And so this allowed for an explosion in wastewater-based epidemiology in 2020 in a consideration of all these other various ways we could potentially implement wastewater and how it could be used for both health and non-health purposes. And so also in 2020, the US government decided to establish the National Wastewater Surveillance System, NEWS, which is run through the CDC. And they maintain these kind of up-to-date dashboards on their website, which I pulled this one from a couple of weeks ago. This one's highlighting SARS-CoV-2 levels in the country, but they've got over 1,500 collaborating sites across the country, representing over 50% of the US population. And you can currently look at 4 different pathogens using this: influenza A, SARS-CoV-2, RSV, and Mpox. Mpox, they haven't been finding anything the last few weeks, thank goodness. But it really highlights how expansive this type of tool can be used for public health surveillance in an aggregate kind of population level way. It's been used for a variety of other diseases as well when you're thinking about hepatitis A and norovirus in a variety of other countries. But really diving into the public health utility of it. So potentially cost effective as a surveillance methodology because you're able to look at kind of groups and communities of people rather than just looking at specific one person participant enrollment at a time. Potentially faster public health responses because we're potentially able to detect the presence of infections days before you are symptomatic and presenting clinically, and the potential to respond to emerging outbreaks earlier to better curtail those impacts. So we've got a classic epi curve down there at the bottom. And so if you're able to act a little bit further to the left and earlier on that outbreak, then you'll potentially be able to mitigate the amount of spread and burden caused by that outbreak. And then this community focus where you're able to more specifically target interventions at certain levels of community, depending on where you're doing the surveillance methodology. where you're picking up your wastewater to do the testing. And also when we're thinking about, healthcare disparities and public health infrastructure disparities, such as rural versus urban, where are the places that people have access to testing and healthcare? Wastewater surveillance can potentially help cover those gaps in areas where people otherwise wouldn't be going and getting tested and getting care. And so we just don't know what the burden is in those areas as accurately. And so, yeah, I think the other part of this is learning a little bit better when to turn on the public health spigot and when also to turn it off when we know trends are decreasing as well. So there's a lot of potential there, particularly when we're thinking about infectious diseases. However, as I mentioned, there's a lot more to the potential for wastewater surveillance than just strictly health-related purposes. To me, similar to AI, the technologies and uses surrounding wastewater surveillance are really still developing, and there's a lot in terms of, some purposes are currently in use and work well. Others need a little bit more refinement. Some uses are in development and are on the near horizon. And then some uses are these long-term potentials, which bring many potential concerns, but which we don't know if the scientific muster will hold up over time. And so illicit drugs is an example of an area in which we are currently using wastewater surveillance. And at a kind of official government sanctioned level, the country of Australia is utilizing this, their National Wastewater Drug Monitoring Program. Maricopa County and Arizona, a variety of other countries across the globe are looking at illicit drug use over time in different communities. This image here is for New Zealand as well. There's also the potential to use it for non-communicable diseases like cancers and cardiovascular disease, which may be interesting. One thing that's potentially disturbing is being able to characterize the racial ethnic composition of communities kind of percentage-wise, and when we're thinking about how that could be weaponized. In my current role at GEIS, the DoD Global Emerging Infection Surveillance Branch, our labs, we're looking at ways in which antimicrobial resistant pathogens can be traced via wastewater, and kind of linking that with what we're detecting clinically in hospitals versus what we're finding in the wastewater coming from those hospitals. The CDC also has their own AMR wastewater group that's looking at this. Kind of going to non-communicable diseases, University of Wisconsin, they've produced a couple studies where they've been able to predict the level of obesity in certain communities up to 80 to 90% accuracy based off of the microbiome composition that they're detecting in wastewater. And so one thing else that I think is interesting and relevant for a military is individual level detection of people, which is very scary. But from what we've seen in certain media publications like Time, for the Bin Laden raid, apparently wastewater was implemented as part of their detection strategies to confirm his location before that was actually engaged. So there are very many, potential uses and significant ethical questions surrounding when and if wastewater surveillance should be used, and importantly, how that data should be responded to. So a couple of kind of unique military ethical considerations, which I think are important to elucidate, just because I don't think a lot of people, even in bioethics, are kind of in tune with what makes the military context kind of unique, and how might that change the calculus of what we're doing here. So first, what is a military, right? Thinking of it to appealing to the philosophers in our crowd. For us, it's an organization of people dedicated to protecting and serving the interests of its state and its citizens through, when necessary, the engagement of authorized deadly force against hostile enemies that threaten those citizens and interests. We present ourselves as defense, and sometimes it's defense through offense in certain contexts. I doubt you'll find any state that will say They have they use their military for offensive purposes. But those who serve in a military can expect to be placed in dangerous circumstances that can threaten their survival, can have serious ramifications for their long-term health and well-being. But potentially harmful exposures are not necessarily restricted to just combat zones, right? It can manifest through mere association with military institutions in non-combat contexts, through prolonged exposure to its cultures, environments, policies. And, when when I mention something like the military, the image that pops up in people's minds is the top one with special forces going in there, guns blazing, right? But really, the majority of us are the bottom picture, working at the desk and making sure that we're kind of leveraging all the capabilities and capacities of the military. It's really just a component of us that are out in that really direct combat role. And so military exists in this really unique position. It's an organization in which the members willingly or knowingly join or conscripted into service with the knowledge that there's this increased risk of mental or bodily harm to their person compared to many other occupations. The U.S. military, for example, it's a volunteer service. And though it's periodically conscripted citizens into service through drafts in times of war, but to be sure, there are certain unavoidable and justifiable risks faced by those serving in the military. But while the nature of the profession can be inherently dangerous, it doesn't follow that its members be placed at undue excess risk if that risk can be reasonably avoided or reduced. And so for this particular issue, I think it's important to differentiate between justifiable harm versus wrongful harm. And so justifiable harm in this military context can come from the mental suffering or physical trauma when engaged in inherently risky training exercises, or when ordered into an active combat zone, or attacked by an enemy force, for example. And these are the harms that service members need to expect to face, or at the very least, they can't rule out. And wrongful harms, on the other hand, are those traumas incurred outside kind of those aforementioned arenas, which can oftentimes be prevented. And so those harms can include kind of policy laxities, unique cultural influences that place members in dangerous non-combat occupational environments, or lead them to have a significantly increased risk for self-injurious behaviors in a variety of different ways. And so many civilian organizations define some ethical obligations to ensure the welfare of their constituents, but to me, the case is meaningfully different for military organizations. So unlike civilian organizations, a military impacts the lives of its active duty service members to a much broader and deeper extent. The military operates as this hierarchical, authoritarian organization, and this highly asymmetric power dynamic really elevates the ethical responsibilities of those in command to care for those service members under their charge as their ethical subject of responsibility. So kind of describing the active duty service members experience these substantial direct impacts, in terms of where to live, what to wear, how to behave, who I'm allowed to date, how I have to shave every day, when to engage in battle and potentially die. So there's these direct impacts which can be incurred. There's also these indirect consequences through, these culturally induced like detrimental habits, these physical disabilities, chronic diseases, mental distress that can occur depending on the unit and the leadership in command at the time. And so these direct and indirect impacts kind of impact almost every aspect of service members' lives due to the involvement of the military and the leadership apparatus. So military policies and practices deeply affect active duty service members' lives, both during and after service, and the durability and profundity of these effects to me, is what establishes the ethical grounds upon which any and all military policy should be structured. And so that ethical obligation is fortified by the extent of control a military exercises over its personnel. And I think these are things that we need to be taking into consideration when we're thinking about how we're using wastewater surveillance and how it's impacting our service members. I think one other thing to note is that, the military has this responsibility to its nation, to its state, to ensure that its fighting force is as strong and ready as possible to protect and defend its citizens against threats. By not striving to achieve high levels of health and well-being of its service members, a military potentially leaves itself in a weaker state and less prepared to fulfill its fiduciary responsibilities to its citizens. And so taken together, these factors really necessitate a concerted effort for military to remain both cognizant of these potential ethical impacts of the decisions and policies they're making, and to really ensure the focus remains on the well-being and readiness of its personnel. So just going to go through this one a little bit quickly, since I touched on some of these points already. But there's some unique ethical considerations in the military. So this specialized population, we've got these unique vulnerabilities in terms of what we're allowed and not allowed to do. We also, unlike many civilian organizations, are under threat to our well-being from foreign aggressors. And there's kind of this lack of self-determination along many ways and lack of autonomy in a lot of ways that our civilian counterparts are able to enjoy to their full extent. As I mentioned, military exercises a significant control over its service members, where to live, how to groom, what to wear. And this rank authority plays a significant role in terms of how to operate, how to behave in a military cultural context. And then national security and accomplishing the mission as a top priority. I think this is where it gets interesting because, depending on the context, this can manifest as different intervention decisions at a clinical or public health level compared to a civilian context, depending on the situation. And, to highlight this, military physicians and public health practitioners, we take this Hippocratic oath, but we also take this oath to the Constitution, which can arise with some conflicts of obligation, depending on, let's say, for example, there's a crisis, there's a mass casualty scenario in the US, and a military medical center is receiving casualties that are both military and civilian. And so how are you going to work on prioritizing who to treat first to be able to respond in the most effective way that is both upholding your duty as a physician, but also to the security of your country, right? So just a little bit of a taste of some of these kind of unique ethical considerations for the military. But let's apply that to the wastewater surveillance context in the DoD. So a couple things to highlight here. So the DoD and militaries in general really prioritize public health. They really value it. And if you even look historically speaking, disease and non-battle injuries have always been the leading cause of casualties in every conflict ever. And for the US military, up until about the Korean War, it was also the leading cause of fatalities in every conflict. And so, if you have soldiers dropping like flies due to infectious disease outbreak, that can significantly decrease the operational effectiveness and ability to successfully complete your mission. That's something that the DoD is really going to care about and prioritize. Something else we also have to worry about more so than the average person is biological warfare agents being able to detect and respond to those. Even though the US military and our allies, we don't engage in biological warfare, that doesn't mean that our enemies won't. And that doesn't mean that they won't abide by the rules of war. And so there's currently actions going on to prioritize wastewater surveillance in the DoD. with really strong efforts starting this year. Tens of millions of dollars getting invested into it. Specifically, when we're thinking about Navy Pacific Fleet, we've been engaging in some collaborations with Bill and Melinda Gates Foundation. For my job and my particular work, we're overseeing several wastewater surveillance projects across the globe. And I put up this image here to really highlight that when we're talking about the DoD and the US military, we're not just talking about NORTHCOM. We're not just talking about the United States. Our presence is global, from the seafloor to space, right? So we have public health research laboratories in South America, in East and West Africa, in Eastern Europe, in Southeast Asia, and we have military installations all across the board, in all of these regions as well, which is part of the reason why we have these geographic combatant commands overseeing all these different areas. And so where we're talking about a DoD wastewater surveillance network, we're not just talking about DoD uniformed service members, we're talking about a global network involving both military and civilians, both US and non-US, right? So to me, this really highlights kind of the ethical importance of diving into why this is an important topic worth diving into. So first off, we have to define what are our targets for wastewater surveillance going to be. I started to tease the idea of, well, we have these really kind of infectious disease, strongly health-related targets, but then we also have a lot of concerning potential future targets as well. But I think, first and foremost, the scientific evidence and methodology for wastewater sampling and testing needs to be established for each pathogen or target under consideration for surveillance, because it would be ineffective and an unethical use of resources to just blindly pursue at-scale sampling of targets without first determining a sufficient level of understanding for them, right? And so for infectious diseases, this might include pathogen-specific knowledge of, the sampling and detection methods, the lab testing, genomic sequencing, and bioinformatics analysis. The surveillance has done so in relationship to the detection levels of wastewater compared to clinical manifestations of disease, and kind of the methods that we can use to mitigate the spread. If we don't have these components, then we're missing the thread necessarily. There might be pre-existing public health opportunities that those resources would be better dedicated towards. And so I think a key component to conducting ethical public health activities includes ensuring that the surveillance and responses to that surveillance are done so in effective, scientifically sound, and evidence-based ways, because if not, those negative opportunity costs are just going to be too great, and it's just going to be an inefficient use of public health funds. So our very own Nancy Cash, she describes in her ethical framework for assessing public health programs that one of the key aspects for an ethically conducted program includes its effectiveness in achieving its stated goal. I would also expand on this to say that monitoring and program evaluation should be incorporated into the running of the public health program to ensure it is supporting its goals. And for wastewater, that might involve monitoring to see whether the programs are doing an effective job in actually limiting infectious disease transmission and the burden of disease in the communities in which it is targeting. And so currently, most wastewater programs are focused on infectious diseases. A few are on illicit drug use as well. But there are other potential targets that have been explored beyond infectious pathogens. And it's difficult to predict which technologies will become available in the future to assess through wastewater. And so I mentioned a few here. The genetic tracking of individuals is particularly concerning. Being able to potentially detect reproductive medicine metabolites, being able to look at the racial ethnic composition of communities. I think utilizing wastewater surveillance for the purposes beyond promoting and preserving health can be dangerous and cause some really ethically fraught scenarios, particularly when we're talking about in a military context. And, it's really important for us to thoughtfully consider what could become possible for wastewater when we're defining its policies now, even before we fully understand its potential future scope, and what the DoD leaders and policymakers must be aware of moving forward so they can keep the focus of wastewater surveillance trained on appropriate health targets and health promoting outcomes. And so I think another key area we really need to address is where we're doing wastewater surveillance. And so, that question is important, ethically, practically, legally, because there are relatively few areas where one could conduct wastewater surveillance and only have active duty service members included as part of that sampling population, right? So understanding the size and vulnerability of the populations targeted by wastewater can influence that interpretation and reactions to the data produced by it. So ultimately, when we're exploring where to do wastewater surveillance, we're also really asking the question on whom should the DoD be doing wastewater surveillance. There's kind of on the face of it, on-base DoD locations and DoD transport vessels are kind of obvious areas to focus wastewater surveillance efforts, which kind of manifest in these 4 different areas in my mind: buildings and facilities, to include large transport vessels, clinics and hospitals, recruit and trainee sites, and housing. And so when we're thinking about, these areas, especially DoD buildings, facilities, and clinics and hospitals, those are the areas that have the highest, what we call force health protection impact, and the highest concentration of service members. And military transport vessels, large aircraft, naval ships, what have you, can be particularly important as sentinel surveillance catchment sites, especially for transmission of infectious diseases. That's something that we saw leveraged during the pandemic for SARS-CoV-2 through the CDC and various other airport kind of based and airline based wastewater surveillance. On-base housing is another area that's really FHP relevant in my mind. These are areas where service members and their families live. There are certain considerations. Well, should the DoD care about these civilian, non-active family members? And really, kind of policy and history shows that they do have a fiduciary responsibility to them through a lot of the programs that they already implement in terms of free healthcare access. I think one thing to remind people of is the U.S. government does have a universal healthcare system. It's the military health system. And as an aside, we see a greater reduction in a lot of health disparities in the military health system versus what you see in the civilian healthcare system. And a lot of that may be chalked up to this universal healthcare access. But we have a variety of other kind of these kind of social networks, programs for supporting military family members. So there's a lot of good reasons for why we should do surveillance in those in the on-base housing as well. So we also have this vested interest in wastewater surveillance abroad for the DoD, though, which can kind of be grouped into a few different categories, like joint military exercises, ally military installations, and these foreign areas of mutual interest with the host nation. And I think that's an area where a lot of our work for GEIS and emerging infectious surveillance lands. We do it in all 3 of those during joint military exercises, where you have a variety of different militaries working together collaboratively in a training scenario in, let's say, the Philippines or Republic of Georgia or what have you. And that there are ways where we can work together in a collaborative way with kind of permissions and signings off from each of the militaries that are involved in that. I think allied military installations is somewhere where really the DoD needs to be thinking about how can it support its allies in a way that is both beneficial for us in our disease surveillance priorities, as well as with our partners abroad. And I think coming at it with an approach of support and camaraderie rather than top-down mandates will also be much more beneficial for us in terms of ally partnership building, but also in terms of us being able to have kind of an ethical scientific relationship as well. And then foreign areas of mutual interest, what do I mean by that? That may mean like foreign civilian hospitals that might be TRICARE approved or Department of State approved, where US service members could be treated locally before getting shipped over to a military treatment facility. That's one way that we see a really strong transmission of multi-drug resistant organisms actually, is where a service member is wounded abroad, gets treated locally in a hospital, and then ends up back at Landstuhl Regional Medical Center or Walter Reed, and they have a variety of different really extensively drug-resistant bacteria. But some of these considerations of how do we work well and ethically and in a public health meaningful way, not just within the DoD, but with US civilians and foreign militaries and foreign civilians. You know, I also have this note for off base, where many US service members don't live in on-base housing. We live in off-base housing, such as myself. I live in the burbs in Silver Spring. Does that mean the US military should be doing wastewater surveillance for our suburb community? I argue no, and that, you know, the questionable kind of legal considerations there as well, but it also highlights the importance that you know, military installations, we're not living in these little sequestered off bubbles in the US. We live in and amongst our community. And so there's this importance for communicating with state and local health departments of what we're seeing in military populations, what they're seeing or surrounding as well. And that sharing of data is an important consideration. And segueing into management of said data, you know, once wastewater surveillance has been conducted, what should happen with that data? You know, there's this challenging balance that we need to strike between allowing useful and beneficial access to the data and the protection of that data. You know, while the possession of large amounts of data is typically beneficial for determining a correct response, course of action, preventive planning, there's also these crucial considerations required for protecting these data. And DoD arguably experiences more frequent and powerful attacks to its information security and infrastructure compared to other organizations. So managing the focus on which data to protect will be and how will be crucial to ensuring data weaponization or leakage is improbable or limited in outcome. I think certainly one thing that is on our minds these days is who has access to federal government data and how do they want to use it? So when we're thinking about as wastewater surveillance data becomes more granular and more specific, the greater the ethical responsibility becomes to ensure data security and access of that data, appropriate utilization of it as well. The escalation of this responsibility, in my mind, is in proportion to the level of that granularity, and it's derived from the increased probability of that information being personalized and potentially damaging to individuals and small groups. Now, for example, depending on where that wastewater is sampled, it could be possible to pinpoint illicit drug use or the location of an individual to a specific household. It may also become possible in the future to obtain personal genetic information via wastewater and to associate this with personally identifiable information. And so the DoD really needs to be prepared to either dispose of or really strongly protect that data, because not only are there risks for foreign adversaries gaining access to this level of data, there's also real hazards to how this information could be misused domestically in politically motivated ways. You know, one way to combat these concerns is to establish clear sampling strategies with requirements to destroy unused sample portions once the appropriate predetermined targets are tested for or detected. But there's also important considerations regarding the sharing of wastewater data, as I alluded to earlier, when it has broader implications beyond the DoD and is relevant to other public health government entities like local state health departments, CDC, ally nations, NGOs. And there are certain ethical responsibilities in the sharing of appropriate levels of data when that information can also be a benefit to others. And the DoD really needs to take steps to collaborate with these other groups, not just live in a silo, to promote what we used to call global health security. And so taking all these considerations into account, like one overarching goal for DoD wastewater surveillance can be to ensure that the data is maintained at an aggregate level as much as possible, and to monitor for community and population trends rather than information on individuals or small groups. So as I mentioned, so for where you collect that wastewater sample is really important. Is it right outside somebody's house? Is it at a dorm level, or for military, a barracks level? Or is it an installation level, or for some, a city level? All of that really influences the granularity and how specifically you can target public health interventions, but it also opens you up to the potential for more personalized misuse of the data too. And so this is where I think there's going to be a lot of ethical questions and a lot of wrestling, which is how to use and how to respond to wastewater surveillance data. So, in my mind, public health surveillance data should not be collected unless there is a potential for meaningful and actionable response to that information. If surveillance findings aren't translated to public health action or policy changes, then the benefits are minimal from a surveillance network. To collect data just for the sake of collecting data is not an appropriate use of resources, particularly in a resource-constrained public health environment. So there needs to be these focused and organized plans in place regarding how to use wastewater surveillance systems and the information derived from them ahead of their implementation. And there should also be these rigorous discussions on how military leaders and public health officials should respond to that information when it arrives to them. Because there are innumerable ways in which leadership could respond to wastewater data when received in near real time. And with that new stream of information comes the opportunity to either ethically utilize that data in ways that is meaningful for public health, or risks for responding inappropriately to it. And I think this is a point that's really important to note, is that oftentimes it's a military commander who makes the final decision of a public health action or intervention, particularly those of consequence. It will likely not be a medical or public health professional making the decision, and that military commander may have no background in medicine, public health, or science. Military commanders, they in leadership, they rely on the expertise of their teams when making those decisions. And so this is really an area where those military commanders and leadership teams need to rely on their public health and clinical experts. So three big key ethical takeaways here. To me, the heaviest ethical burdens that I worry about in terms of wastewater surveillance in the DoD, it's knowing how and when to respond to wastewater surveillance information. Are you going to be doing these sweeping quarantines, these areas of no ingress or egress? How are you targeting certain populations or communities? Two, deciding what to surveil for. Are we going to keep it very much health focused, or are we going to allow for mission creep into non-health related targets? And three, managing the access and security of the data, and who has access to that federal government data, again, is very much on our minds these days. So this last bit is nothing revelatory. It's just something that I think bears reiterating and highlighting again, because I think there are some lessons bioethicists can learn from the military. And I'm coming from a military environment. If you bring up a potential issue to a commander without some sort of practical options of how to address it, you're going to piss them off and they're going to kick you out of their office. And I think that remains true for some bioethicists as well. But one big difference I see is that many, but not all bioethicists include suggested solutions to the problem they raise. I don't hear very much on the back end of them actually doing things to implement the solutions to address those issues. And on the military side, if you find an issue, you either need to lead the solution to that problem or ensure you get the right team involved to address it. I know that's not necessarily the case, especially for the folks in the Berman Institute. I know of all of the different types of committees and engaging with policy and getting in touch with the leaders that happens here, but I don't think it's the case across the board. So I think for me, I've definitely learning some lessons in how to communicate on this wastewater surveillance issue with military populations. And, again, Berman Institute being housed in the School of Public Health, there are many lessons we can take from public health risk communications. There's a focus in public health about how to best communicate risk and epidemiologic findings to the public in ways they can understand. And if that's misunderstood or poorly communicated, this can cause panic or complete dismissal of the concern. In clinical medicine communications, you're an ineffective physician if you only communicate in medical jargon, which your fellow physicians might get, but your patient does not understand the importance or impact of. And so, particularly for us in bioethics, being able to extract ourselves from the philosophical and bioethical jargon to be able to communicate really short and sweet impact statements on what it is that is important and why we're recommending it. How do we actually make our ethical recommendations practically implementable? Meeting people where they're at. So again, lessons from public health, particularly for those of us working in public health and preventive medicine, where we have to be kind of what I call cultural chameleons and able to adapt and translate to whoever it is we're speaking with about any given, medical public health topic. And I think this remains especially true for changes in leadership at any level as well, understanding what are their priorities, what is the language of their priorities, and translating the work that you do in a way that they can better understand and identify with, though with your core work remaining intact. And I think that's something that we see not just from administration to administration, but also, for us in the military, we oftentimes get a new leader every 3 years or so who has different sets of priorities. How can you communicate what you're doing in a way that is important and valuable and non-alienating to them? And so your message is going to be very different when talking to, for example, the Honorable so-and-so in the top versus Joe from environmental health at the bottom versus Karen in the audience from town hall. Really think bioethicists should seek to communicate more openly, approachably with the public, help them understand what the issues of our time are, why they should care, and what they can do about it. These short, easy to understand messages about for the public and decision makers are really important. There are just so many competing demands for people's attention. Like, how can I get people to care about wastewater surveillance ethics when I can binge the entirety of Parks and Rec in just a couple of days, right? How can I snap people into attention about that? So in this DoD wastewater surveillance environment, just to really highlight what that might look like, military commanders, it's really about being a bit of a linguist, right? I'm emphasizing force health protection, medical readiness, operational effectiveness, lethality. These are the buzzwords that really hit home for them so that they can understand what it is that we're doing and why it's important. Epidemiologists, we're talking about distribution determinants of disease. We're looking at odds ratios, relative risk, reliability of the data. public health trigger points for implementing control measures and the messaging around it. Clinicians, especially folks like Jeremy, internal medicine folks, they love likelihood ratios, how our surveillance findings might impact those at all, and what implications there might be for clinical practice and decision making. Environmental scientists, if you don't know the difference between influent versus effluent when we're talking about wastewater, get out of the room. And really looking at what are the different scientific challenges and that might arise from the specific locations in which you're proposing the sampling. And then microbiologists, being able to talk shop with them about a MiSeq versus a MinION, a MALDI-TOF versus a Vitek, quantitative PCR, next generation sequencing and bioinformatics. This will help the effectiveness of your message and actually be able to move the ball forward on the topic that you care about. So I'll end with a question of, do bioethicists have a responsibility to ensure the topics they write about are acted upon in really kind of meaningful and practical ways? I know the writing and establishing the messaging about it is important. And that is the core work of a lot of what we do. But the next steps in being a leader of the change. And I think that's one thing, one lesson that I think the military teaches us is being a leader of the change. So with that, I've got heaps of references and happy to answer any and all your questions. Question about likelihood ratios.
Actually, no. Okay. Thanks for a nice talk and problematizing this for us. First, I just want to make a correction. The Berman Institute is not housed in the School of Public Health.
Okay.
The master's program is housed in the School of Public Health because
I am biased.
Reasons. But I think it's important for some of the generalizations you're making about bioethics and which space they might take place in. So in some of the other schools that work with the Berman Institute, there's work in practical bioethics that is very action oriented and privileges actually action over scholarship or written scholarship. So the work in research ethics, clinical ethics, and the like are actually action heavy and arguably scholarship poor, and could probably benefit from that. So just as you talk through this, my question for you is a larger scale one. There are lots of surveillance activities that are going on. This is one of the surveillance activities that we started to hear about it with COVID, as you rightly pointed out. As we are facing lots of changes in our public health system, where does this form of surveillance fit with other ones, and how would you prioritize, given likely less resources for public health, which surveillance systems for infectious disease would you privilege and why?
Sure. Yeah. So, we have active passive surveillance for infectious diseases, which can give us a lot more potential clinically relevant data in terms of the metadata involved, which wastewater surveillance will never be able to. However, we need to find space for wastewater surveillance in this, particularly when we're looking at ways to implement public health surveillance in a cost-effective way that can be population-based. However, I think one of the key considerations, as I mentioned at the top, which was the scientific soundness of the targets, right? So for those targets where we still are not on solid grounds for infectious disease surveillance, we should not be gearing wastewater surveillance towards that until it's sufficiently solved, right? And so our current existing infectious disease surveillance efforts should continue to really be prioritized in those effects. But yeah, to me, it's not a question of either or. You're still going to need both, but wastewater surveillance needs to be a part of that question, because not only are you able to just, with one dip in the wastewater, test for one particular pathogen, you're able to test across the board. You're able to potentially do pathogen agnostic sequencing to be able to detect emerging or unknown threats, including bio threats. So I think the the outstanding potential is there. We just, again, it's in a resource constrained public health environment. That's always the ticket, isn't it?
I waited to see if anyone else had their hand because I have a really, really newbie question.
Good.
So somebody who has never once thought about wastewater surveillance before.
Mhm.
You asked a lot of ethics questions about how we could use the data and what would be permissible, et cetera. Is it accepted that it's permissible to just take it?
To take the wastewater sample?
Yeah.
Yes. So there's a lot of, there's a couple of legal publications that have come out to say this is kind of part of the scope that can be involved for conducting public health activities, right? I think there haven't been, as far as I understand, any direct challenges to that since it's still very new and it hasn't been leveraged in a very person-specific way, disregarding the Bin Laden example that I gave.
Yes. So again, total new, very open to have my suspicions easily allayed. But you mentioned the illicit drug context, which is I'm me, so that's immediately where my mind went, right?
Who, you?
And so one of the first things that I thought is, not a lawyer, but you have to get a court order to access wiretaps and that sort of thing, right? And so suppose we could do that in a more aggregate way, where you could get all of the phone data from a dorm and have AI search for symptom language, and then use that to decide, you know, is there likely to have been a COVID-19 outbreak in this dorm because people are talking about being ill on the phone. I start to get my like ethics spidey sense tingling that like we probably shouldn't be listening to people even for public health purposes because this information feels really dangerous. And the wastewater symptoms or the wastewater surveillance starts to feel a little bit like that. So I'm going to stop with follow-ups after this, but that was like, I don't know. I didn't feel great about the whole thing, to be honest.
Was there a question? Okay. Yeah, I think that's why when I think about this, keeping the sampling and strategy as aggregate and population level as possible helps to assuage some of those concerns. But regardless, we don't know how granular we're going to be able to get into the future, and necessarily how that data is going to be responded and acted to. But yeah, I think the other thing to note here is there's a lot of noise in wastewater. And so it's extraordinarily difficult to work with in any sort of very kind of scientifically specific way. But I can't tell you anything that's going to make you feel better about it right now, other than what was this MBE even for? If not to help Travis make you feel better.
Well, with that, I will note, I would still say a masterful job of answering a question of making me feel better in current time. So thank you, Hunter, very much for joining us. Thank you for